the process of actually doing all the final drawings won't be done until March, probably March sometime, right, Andrew? And this process that we've used is quite different than what I was used to when I was with the Ministry of Health, when we had a normal, or what we would have called then a normal design build process, which was talk to the staff, get their input, architect takes those ideas away, draws a blueprint or draws a plan, that plan goes to the market, and then the general contractors bid on that, and best price wins. This one, the process is quite different because we've had the architects, the general contractor, the engineers have all been in partnership with us through the whole design phase. So the architects and the general contractor, there's no surprises for them. It's not like they have to go back. The general contractor doesn't have to come back to the architects and say, what does this mean? Because they've been in meetings since last April, or even earlier than that. Anyways, that's a little bit about the process. Again, we won't be able to answer every question, but whatever questions you do pose, we will take note of those. And because the design isn't final, if there's some things that you see or that you raise that you have concerns about, then we can take that back to the architect. So it's still not, we met all last week, did presentations for our staff, and have taken their feedback throughout this process and are still taking feedback from the staff to influence the final design. So I'm going to introduce our project manager. Again, if you want to wait until after the presentation, it'll probably take about 25 minutes or so, and then we'll field all your questions as best we can. So I'll just ask John Ligori, our project manager, to lead us through.
Thanks, Bert. Good evening and welcome, everyone. I want to make sure you can all hear me okay? Great, thank you. So welcome. It's my privilege to walk you through the initial part of the presentation and really give you an overview of where we're at. So let's begin. So right now we're going to provide you kind of some general information, and the reason for that is we're not quite finished this design, as Bert mentioned a moment ago. So we continue to do that work. But we are going to give you a sense, our community and of course, those of you, all of you, our communities are our patients. We want you to have a sense of where we are today in this great process. So I'm going to tell you a little bit, Bert said we are using a different approach in terms of not only how we're designing and ultimately how we will build this new hospital, but also how we will operate in it. So I wanted to give you just a little bit of background on LEAN. LEAN is the strategic vision of the Ministry of Health and our government to move to a really patient-centered healthcare system. So this initiative is taking place in every health region across our province, and it's really meant to improve the healthcare experience for our patients and the communities we serve. So LEAN, if you're not familiar with it, doesn't mean doing more with less. It's actually quite the contrary. LEAN means focusing on what our customers, which is you, our patients and the communities that we serve, of what is the greatest value to you. So really what it is, if I can put it simply for you, is looking at all our processes, how we do our work, how we provide services to you and to the communities we serve, and eliminating the waste. Waste such as waiting, walking, perhaps checking in multiple times, going from one department to the next, often being asked and having to tell and answer the same questions over and over, right? So that's what we're talking about. So to really move to a patient-centered system and take all the things that really provide no value to you and to the communities we serve. So with LEAN, the process we started with, and to give you a sense, we've had three kind of major design events that we call 3 Ps, and the P stand for production preparation process. And what that is a method that we use to bring together the actual healthcare providers, but also the patients and the family members that receive the care, and bring them all together working as teams during these week-long events. And we've had 3 of those design events. The first one took place in April, and it focused under what you'll hear about in a moment, the Universal Care Unit, which consists of emergency, observation, our day surgery unit, the operating rooms, diagnostic imaging, and Andrew's going to walk you through all those areas more specifically. And the second event we did was totally around the inpatient units. And more recently, in early November, we finished the last repeat, which is for collaborative care, which is the outpatient area. And you're going to hear about all those areas. And so again, what's unique is the doctors and the nurses and all of the staff that work in different departments come together, they form teams, and they're asked to collaborate and work together in the same room over a week, and to really come up with the best flows, how things will work for them. So traditionally, and their role hasn't changed. Our architects and our engineers are fundamental to designing any facility, but particularly a complex facility like a hospital. And what's a little bit unique in this process is that the people that are going to work and that receive the care in the new hospital, they're actually providing more of a lead role in informing what they need to the architects. So the architects are active participants, but they're not necessarily the main kind of act, right? The main act is the patients, the families, and the staff and doctors that will work in these areas. So that's what's unique about it. So to give you a sense for those 3 events, we've had about 200 staff, frontline staff, doctors, and patients and family members that have helped us, right? There's a lot of other staff. There's closer to about 700 that work in the hospital. So part of the process is when we finished these events, we invited all of the staff and physicians that wanted to attend to the warehouse facility that we used to do the planning work. And they were able to see and hear what the teams came up with. And of course, you're going to see the fruits of their labor in a moment. And but they were also able to give some preliminary comments, things that the teams could take back and review. And so the way the process works is the architects went away after those events and they produced the first set of working drawings or blueprints. And then we met again with the teams within about 30 days or so. And then we meet again with them about 2 months later and about 3 months after that till we get to final design, which we're targeting for towards the end of March. So I wanted to tell you a little bit about that. So here in this picture, you could see this is one of those events. This is a bunch of the team members that were actually working on mapping out very early on the week. They were working on mapping out the key processes, sort of the people, the equipment, and the materials that are used in each of these distinct departments to provide patient care. And so it's a very hands-on type of experience. You might know some of our staff or physicians that have participated, and if you do, I certainly invite you to talk to them. The other key part is that, as Bert mentioned, we have our architects, our engineers, but also the builder that's helping us with the design process. So that's quite unique and special. Here's another picture, and you could see it's quite a large group. Here, what the teams were working on, this was in 3P1. They were working on what we call the adjacencies, and you're going to see them here on the boards and when Andrew comes up to present them. So this is sort of who lives next to who, how are things organized, the layout, and the staff and physicians and the patient and family members had quite a discussion about that. In fact, originally we started with a concept, and then that concept got all kind of shook up and rearranged, and that's okay because that's part of the process, right? Because we really want the facility to work well when we actually move in it after it's built. So here you can see the teams talking and collaborating, and in this particular one, you could see it's kind of like a large group discussion. In the previous slide I showed you, you saw that it was a smaller team working on a problem. And to give you a sense, sort of the power of working together as a team, one of the unique things how the design started to evolve is we went through an exercise called the 7 ways. And so every person, so the groups were 50 to 60 participants. Each participant is asked to come up originally early in the week with 7 different designs, something kind of unique that they feel would work, right? And then from those 7, so if you do the math, 7 times 50 or 60, right, you soon get several hundred good ideas. And then the teams, though, had tough decisions to make because they then had to narrow it down to 3 ideas. And I'll just show you the next slide here. And then from those 3 ideas, they picked the best 3. And here you can see they're working on the models. Right in front here, you could see there's different sizes. This team here in the far was working in the operating rooms. This team here was working in the main, what we're calling universal care unit, which is emergency observation, day surgery, and we also have our pre-admission clinic and testing, and it's right adjacent to the ORs. This team here was working, I believe, on diagnostic imaging, where all the radiology and tests take place. So from those many hundreds of ideas, they narrow it down to 3. They actually construct a model. So this is a 2-scale model. They start with 3, and then they have to narrow it down some more to 1, sort of combining all the best ideas. They get to test the flows. We test the flow of patients, of course, which is vital. The flow of the providers, that's the physicians and staff, all staff that provide the service, equipment, materials, and so on, right? And so they actually use color strings, and that gives them the visual to actually see if there's a bottleneck somewhere, if people are going back and forth or too far a distance to walk or travel. Again, part of our motivation was to reduce the waiting, but also the walking for everyone, the patients certainly, but also for the providers. And then once they've sort of, while this work's going on, the architects are participants, and there's other consultants, the folks that are the kind of the process experts that help us kind of understand how the flow is working or isn't working. But the fundamental concept of this is the people that are receiving the services and the people that are doing the work are the ones informing the process as opposed to the other way around. It's not necessarily the designers. Eventually the designer gets to critique it or offer their help and advice, but they're not the key participant. So once we had the models, you can see in the back here, the large pink areas, those are full-size mock-ups. So in this particular event in the back here, we mocked up one of the new full-size operating rooms. So the staff, you can't see very well in this picture here, but they actually put in a piece of equipment called the boom, where all the medical gases and other specialized life-saving equipment is kept. They brought in all the carts, of course, the patient, the stretchers. They mapped out how many people, the team, the surgeons, the nurses, the assistants that helped during a case, and they literally positioned themselves to make sure that it was going to work prior to kind of signing off the week as the preliminary design. In the back here, we had a standard patient room, which we're going to tell you a little bit more about. We had also the CT suite, the new CT suite mocked up. And it really, the staff and the physicians and the patients that participate really get value out of this because, you know, most of us aren't used to looking at something on paper. If you've ever seen a blueprint, you know, it's hard to visualize what it's really going to look like in full life. So when you're standing in a room and you can see where the equipment is, the actual counters, the height of them, you know, somebody could say, well, this doesn't work for me because I got to bring a stretcher through here and there's a counter in the way, or the counter is not, it's too low, it's not high enough, or the supplies that I need aren't going to fit in this corner. So it's very visual that way. And as a consequence, you're going to see now some of the outcomes of this great work. And I think at this point now, we're going to show, first the design highlights, and then we're going to show the video. Thanks, Kyle. So let me tell you a little bit about the design highlights. So I'm pleased to share with you that all of the treatment rooms and the inpatient rooms, so 72 inpatient beds, and the 43 treatment rooms in the universal care unit that you'll learn more about, they're all single private rooms. There's no sharing of rooms. Of course, we have 4 operating theaters, 2 procedure rooms for endoscopy and cystoscopy. They're special procedures, day procedures in most cases. And then, of course, there's an operating room also in the labor and delivery unit, which is critical for C-sections. And the hospital's been designed with great flexibility, and I wanted to tell you a little bit what we mean by that. So currently in the new hospital, we have right now about 2 isolation rooms, really 2 rooms that are truly what we would call isolation rooms. So they have special mechanical ventilation to protect either the patients inside the rooms or those folks outside of those rooms. And there's only 2 of those rooms right now. In the new facility, we will have 7 of them, including some in the emergency room, where a lot of times that's where many of our patients begin their journey. The other is, right now we have 1 bariatric room in the hospital. Bariatric rooms are for our patients that are very large and have special needs. So for both their safety and that of the providers, we need special equipment and different equipment. And the room has to actually be laid out and constructed a certain way. And unfortunately, right now, we only have 1 of those rooms. And actually, the 2 isolation rooms I spoke to you about and the 1 bariatric room are actually in the newest development, which was the new ICU that was done about a year and a half ago. So it's a relatively new kind of amenity for us at the hospital. So in the new hospital, we will have 8 of those bariatric rooms. And the other is the current hospital has a dedicated ICU, and there will be a dedicated ICU area, a 4-bed unit in this hospital as well. However, we are going to have a total of 18 rooms that are what we call acuity adaptable to a critical care or an ICU standard. So that will give us far greater flexibility than we've ever had, and that's what we mean about the flexibility. And when Andrew will walk you through the different areas when we get into that. So we're going to put together, or Kyle here helped us put together a very short video that we'd like to share with you. And go ahead, Kyle.
Well, it's been a career-changing experience. I mean, I feel empowered. I feel empowered to do better for my clients. Wow.
It has, what have I taken away from it? That change can be good. Don't be afraid of change. And organization and getting rid of the waste that I didn't even know existed. Because when you actually walk through the process and you see what you're doing and somebody asks you why, 7 whys or 5 whys, whatever they are, why are you doing this? And you really don't have a good answer, but you just do it because that's the way that you've always done it. You don't need to do it. It doesn't need to be done, and it can save you so much time. And then you have more time with your patients.
Absolutely. I think that what we see through this process is that you see at the beginning a lot of skepticism, a lot of a lack of understanding in terms of what is being achieved, and then as we start working together and everything starts coming together, the excitement grows as people buy in more. They get more excited about it, and that's fantastic. It's also a little bit festive as well. The other thing that you see is team building. You know, in the last 3 days that I've spent here, I've got to know and spend time with people who I've seen every day for the last 13 years, but I didn't know their name, I didn't know who they were, I didn't know what they did at the hospital, and so from a team building point of view, it's been fantastic as well.
Well, I think it's always exciting when it's either some people would be scared about change, some people are excited about change. It's always difficult, but I feel like the very fact that we're working towards this new facility and building it in this way, it feels exciting. It feels like, okay, well, I can do something to make changes. So when I look back at the end of my career, I can say I was a part of something that was really spectacular, and I really want to believe that that's what's going to happen.
The whole concept of how to develop a healthcare facility where you're inviting the community to come in and participate. I've never heard of that till now, and I'll never forget this, ever. I'm thinking to myself, to my grandchildren 10 years down the line, if they're coming through, I helped do that over there. I put the models together, you know, and it's always going to be here with me, you know, and I really appreciate it. So just can't believe that I'm actually here, but I've enjoyed it. I really have.
So it's my pleasure to introduce Andrew Flanagan. Andrew is an architect on our team, and he's our lead designer. He's going to actually walk you through the new facility, at least as in terms of where we are today. Thank you.
Thank you, John. So I'm going to just walk through the site plan first, give you a little orientation. This is the Trans-Canadian Highway here. You can kind of see in the corner of the slide, this is the Western Development Museum, Highland Road, and then Main Street is kind of off the page here. Kind of runs north-south here. And then the road along the site here is Diefenbaker. The building there is in the orange color, and then I'll kind of walk you through a little bit more here. But our overall site, we've got a little over 30 acres. We're not obviously using the whole thing. The site is bisected by Diefenbaker, so there is some availability of a parcel for future outpatient services or other medical expansion. This is just a little blow-up of the site here. Our traffic studies show that the 90% of the traffic is going to be coming from the Main Street direction. So the building is oriented to that Main Street direction. So coming up from Main Street, up Diefenbaker, this will be the main drop-off, or the main turn-in, coming to the main drop-off of the hospital. That's the first entry point. If you turn down south from that entry point, there'd be a parking lot here dedicated for outpatient parking, as well as some staff. And there will be a dedicated entry into the building from that outpatient area as well. If we go up a little further, back out the main entry, if we continue on, the second entry point off Diefenbaker is the walk-in emergency, or ED entry. So public and patients will be coming here, dropping off at the ED, which is at this entry, and then coming back out to park in this lot that's also shared with the main entry. A little further up the road is a dedicated access for ambulance traffic. Ambulance traffic would pull in. We've got a garage space there for 2 ambulances, and then patients would flow in an enclosed vestibule into the emergency area. We do have a helicopter plan for the site, or helicopter pad. The helicopter traffic comes along the Trans-Canadian Highway, so that's why that's the northernmost portion of the site. It's also situated to be very close proximity to the emergency room. So you get that easy connection. Continuing on, the second entry here is more of a staff entry as well as loading and support traffic. So staff would come in into this lot, and then support traffic would continue on, and this would be the loading dock for the hospital. All away from really the main traffic, which is again coming from Main Street. This is really just a snapshot of the plan. We've still got a lot of work to do in terms of the overall landscaping, so just the concept right now. Okay, so this is the first floor plan. We actually have a 3-story building here. One of the main things before I get started is we have an on-stage, off-stage concept for design. So that means public and patients are really always kind of segregated to one area, and staff is segregated, and supplies are segregated to an area behind the scenes. Almost like visiting Disneyland, where you don't see the guys getting the rides going and cleaning up behind the scenes. The concept is to make it more of a patient-focused environment, and less clutter, less confusion. So with that said, the yellow area is in the front of the building. That's our public zone. And then we do have a corridor in the back here that's dedicated for patient transport and support traffic in the hospital. So as you come in the main entry, off to your left would be the gift shop. As you continue on, really the first thing you see is going to be switchboard and admitting. So that's where you'll do your main check-in for acute care services. From that check-in area, there's really kind of two directions you'll be directed. One is into our universal care and diagnostics or radiology area. The other is into day surgery, so prep for surgery. And then into the elevators that would take you up to the inpatient units on the next two levels. If we come in the first entry, diagnostics is along the side here. And again, that's radiology, so that includes a couple of x-ray rooms, fluoroscopy, ultrasound, stress test, mammography, and CT. The area in pink here is what we call our universal care. So that's a 43-bed unit, and that includes emergency, PAC or pre-admission clinic, observation, which will be a stay up to 23 hours, and then day surgery, which includes the prep for surgery and recovery. Directly adjacent to universal care is the surgery area. So that includes the 4 ORs. There's also an endoscopy room and cystoscopy room in that area, along with the post-anesthesia care unit. So as you come out of the OR, you'll flow into the post-anesthesia care unit, and then you'll flow directly into the universal care, which is your step-down recovery. We do have one support space in this block, and that's central sterile to really support the OR area. That's their main user. If we come back to that front entry, the fourth point on that entry is more of outpatient services and also the dining area. So the first stop here, dining adjacent to the kitchen in orange. And then our next stop is really our patient teaching area. The primary focus is patient teaching, so education for diabetes, chronic conditions, prenatal care. As a secondary component, it would also be used for staff training and staff meeting area. The last piece here is ambulatory care. That's really our main outpatient services area. That includes dialysis. There's 9 dialysis stations there. Outpatient lab. So this is where you'll come for your blood draw. There's two rooms there, therapies, and some additional smaller patient education rooms. In the back here, again, this is that white corridor. That's staff only. This would be materials management, so your central supply and storage area, some mechanical area, medical records, and then the main lab. So this is our second level. Public would come up the front elevators here. And if you went north, again, we're keeping our acute care services on the north side. So this is our first level for the nursing unit. This is 36 beds on this level. This is mental health on this level, ICU, and medicine beds. There is an outdoor garden space dedicated to mental health patients. As we come down south to the more outpatient services area, the first stop is, there's a small area that's a chapel here, and then the next step is outpatient mental health services, trying to get those directly adjacent to the inpatient mental health services on the other side. There is a large meeting area that seats about 100 people here. Again, that's for staff meetings as well as patient education. There's also some additional smaller meeting areas on this floor as well. The teal areas here are really administration. So senior leadership, pursuing excellence offices, finance offices, and then IT and biomed, and then the main pharmacy on this level. Again, that's all back of house, no public access to that component in the back here. So this is the third level and final level. Again, this is 36 beds, so with a total of 72, as John mentioned before. On this level, we have PEDS beds, LDRP, which is labor delivery recovery beds, so women's services. There's also a C-section room on this level. That'd be centrally located. And then the rest of the beds on this floor would be surgical beds. And then some mechanical space below that. So I'd like to introduce my co-lead on design, Derek Lamb, with Stantec Architecture.
Thanks, Andrew. As we go through this process, there's obviously the outside portion of the building that we're trying to make match the features of what's happening on the inside. We are trying to take as much advantage of opportunities for natural light with materials that are both durable as well as energy efficient. As you can see, we're going through a series of number of options. We have 4 options being shown right there where we have different opportunities and different types of aesthetics that we've bounced off the public in terms of what kind of aesthetic they'd like their hospital to take. Much of the feedback that we've been getting is they would like that this facility represents what's happening inside, in which case is a state-of-the-art type of facility. With that in mind, there was a kind of a movement away from the traditional brick. If you look at the middle what happened there? Okay. Oh, there you go. If you look at option 2 there, which is more of a heavier brick type of facility, one of the discussions that they talked about, is there a way that we can make this a little more playful, something that makes it a little more modern, something that makes it look more state-of-the-art? So we were looking at more like options 3 and options 4. With opportunities where we can feature some of the main spaces, like the main entry area, for example, where you have some 2-story spaces, you have opportunities to drive lots of natural light, and you have opportunities to create lots of volume. Again, this is a work in progress as we modify the plan, as we start testing the flows and the way people are moving in and out of the building. It's having a direct impact on the exterior building itself.
Thanks, Derek. So let us just give you a quick overview of kind of what happens next. So you've heard about the design is still continuing for a few more months until March. So we'll continue to work with our teams to get their feedback, and so the design keeps evolving. But what you saw in terms of kind of the layout and the adjacencies or the blocking that we call, those are the schematics you just saw. That's kind of what we envision the facility to look like, the orientation, kind of the main entries, so a little bit about what happens then towards the next important phase, which is what our colleagues call production, or the actual construction. And so by early spring, we want to actually break ground and start getting ready to do pilings, and then the steel structure, and then closing in the building by November of 2013. And then we'll continue construction for a full year after that. That'll take us to the end of December 2014. And we envision a transition plan of 4 to 6 months to actually prepare and make the move to the new facility. So by mid-2015, we expect to be operating in your new hospital.